Now let's get into the sexy stuff. Does albumin improve survival in sepsis and severe sepsis? Notice that we're not talking about septic shock. We are talking about sepsis and severe sepsis. And the short answer to that question is no. It does not improve survival. And we're talking about both the 4% albumin as well as the 20% albumin. And this is from the SAFE trial as well as the ALBIOS trial, which were published in 2004 and 2014, respectively. For a little bit of context, the SAFE trial, again, was published in 2004. It was a randomized controlled trial where they gave patients 4% albumin, and they enrolled almost 7,000 patients into the study. Meanwhile, the ALBIOS trial, which was utilizing 20% albumin, registered, or better said, they enrolled over 1,800 patients into the trial. So both the 5% as well as the 20% albumin did not show a benefit with regards to survival. Now, this is my second busiest slide because I actually have to read this. And if you're just listening to this, just know that there is a video version on Spotify as well as Apple Podcasts. What if we do multivariate analysis adjusting for baseline factors, and then they do this analysis 7 years after the first trial took place? It's like, what were you guys waiting on in order to publish this? But when they looked back at the SAFE study and they did this statistical gymnastics, they did find that there was a survival benefit. And their adjusted odds ratio for death was 0.71, which means that could be beneficial for these patients. But if we possibly could have this survival benefit, how much would it cost and how many patients will we have to treat in order to see this benefit? And here I took some liberty. You could criticize me all you want, but I used the values from up to date that I mentioned earlier in this lecture. It would cost about $1,300 or over $1,300 per patient to be able to see a mortality benefit. And that is with the number needed to treat of 19.2. So in other words, you would end up spending $1,300 by 19 patients in order to save one life. How much is a life worth to you? That is worth considering. Obviously, I'm not an administrator. I would do whatever it takes to save a patient's life, but these are just the statistical realities we have to deal with because money is not infinite. I do have to plug in my book, the Vasopressor and Inotrope Handbook. It is available on Amazon as well as my Shopify store. Pick up a copy if you haven't already. It helps support my work.